So the additional restrictions that are being implemented today, or are being announced today, will be taking effect at midnight tomorrow. And so relates to the religious gatherings in Southern Health Region. So the religious gatherings are limited to 25 persons, unless the facility can physically divide their space into separate areas, in which case you can have several cohorts of 25 individuals. The total number of attendees at a service may not exceed 25% capacity of the facility to a maximum of 250 people. Again, that can only be achieved through the use of cohorts if the overall capacity allows. So those cohorts must be separate. They must not mingle in any way. They must have masks on at all times, and distancing rules apply. So this one, again, applies only in Southern Health Santé-Sud region. The previously announced municipalities that are in that capital region, again, are not going to be treated as part of the Southern Health region as for these orders. So Cartier, Headingley, McDonald, Richat, Niverville, St. Francis, Xavier, and Taché will be treated as the capital region as per the most recent orders. So this goes into effect Saturday, November 13th, 12:01 a.m. And so again, services that are restricted to fully immunized individuals, and including those under 12 who are not eligible for vaccine, they can still be held without capacity limits in Southern Health. Services that will not require proof of vaccine will have to abide by these new capacity restrictions starting tomorrow midnight. The next restriction that we are moving to is a province-wide restriction, and it relates to that climbing case counts in that 0 to 19 age group. And so proof of at least one dose of vaccination or a recent negative test will be required for the 12 to 17-year-olds for indoor recreational sports. So this one, we will have a grace period to allow a sufficient time for people to make decisions. And so this will start on December 5th. And this will allow individuals who are not fully immunized or not immunized to comply. This will be in effect province-wide. Negative tests need to come from participating pharmacies. This will not be tests done at our publicly run testing sites. Those PCR tests are for symptomatic individuals or those individuals directed by their healthcare provider to be tested. This testing will have to be done privately for the sports.